Knock, knock, howdy, folks. Dr. Ben back here again. Now is a portion of the podcast we call What the Heck is That? Medicine has a lot of funny terms and words with many syllables, which aren't good for orthopedic surgeons. And so I would like to test both the listener and John on their medical knowledge on what the heck is that. Dr. Justin here is going to give Dr. John and you, the listener, a word, and I want you to pronounce it and tell us what you think it means. And listener, put in the comments what you thought the word meant, and we will go over how accurate that was. And so we'll see how close you are to the actual definition. Or it might be like that game Balderdash. Did you guys ever play that game Balderdash?
I did, yeah. Growing up a little bit, yeah.
You have this word, and then you make up a definition for it and try to convince people that's the right.
Yeah.
So John's going to play Balderdash with some of these words here. All right, listener and Dr. Justin, John, are you ready to play What the Heck is That?
I think I am.
Here's word number one, folks.
Propofol.
What do you think that is? Or
I think this is one of the drugs that you use to assist with anesthesiology. So
Perfect.
Okay.
Yeah.
So it's the other names for like milk of amnesia. Or
it is.
Michael Jackson juice, or
because it looks like milk. It's white.
It does, yeah, it's white. It's actually an emulsion. It's a lipid emulsion. So it looks white. It looks like milk.
Got it.
Orange.
I haven't seen any other drug that's white like that, is it?
The only one I know of is called clobidipine. It's a really short-acting calcium channel blocker used to drop blood pressure, but that's really...
Okay.
Sorry.
I could use that.
So no chance of mixing those up.
All right.
Or intralipid, but I'm getting nerdy here.
Does it come in like whole and 2% or...
It's all whole.
All whole.
It's all whole. It's about as whole as it gets.
Actually,
all right.
1% technically.
Oh, 1%. Okay.
Really?
Low fat propofol for me.
Per cc, so it's 1%.
Can you buy propofol at like a Walgreens?
No.
Okay, I didn't think so. I just wanted to
Michael Jackson had a special connection. It didn't work out too well for him.
And I'm lactose intolerant, so
Dang,
it's still
FDA.
okay. The milk of amnesia is okay for the lactose intolerant.
No, I've never had patients say that.
Okay.
Ironically, it actually is like an egg protein. This is getting into the weeds, but some people with egg allergies will have problems with it, but I've never actually seen it before.
Oh.
So it should be fine.
Okay.
Having actual allergy to it is super, super, super rare. I've never actually seen it before.
Listener, make sure to tell your anesthesiologist any allergies you have before surgery.
Very important. Be honest with your anesthesia people.
PSA. All right.
Good.
That was one. Listener, did you know what propofol was? Okay. I'm excited for word number two.
Yes, here we go.
All right. Word number two, John, is...
Intubation.
Intubation. What the heck is that?
I've heard the word intubation, period.
Okay.
When they're under?
When they're under. Okay. Listener, what do you think? Intubation, when they're under. And then we'll get the answer here from Dr.
Or
Justin.
pre-under. I don't know.
Pre-under or
Yeah.
under? Underwear. Oh, you just made me say underwear.
Intubation is, well, there's different types of airways that we use. Basically, when you're under anesthesia, sometimes if you're really deep, like under general anesthesia, you don't breathe very well or at all on your own. So intubation is the process where you put a breathing tube down into your trachea or your windpipe to breathe for you.
Got it.
Not every anesthesia requires that. Sometimes we'll use different types of airways like a LMA or just some nasal cannula. There's different other options, but that's when we put a breathing tube all the way down into your your airway, your trachea.
At first, I'm not going to lie, our production team has really good handwriting. I'm not making fun of them, but they have this thing that it looks like it's an accent mark. So I felt like it was in Spanish, like intubación.
That's when you're in Tijuana, you get the intubation.
Ah, okay.
I say that for mission trips. Yeah.
Mission trips. Doctors Without Borders. All right.
But sometimes those airways are tricky, in all honesty, and sometimes the airway could go into the esophagus, leading to your stomach. So that's not good.
Yeah, getting it in the right tube, food tube, air tube. I'm trying to dumb it down for the orthopedic surgeons here. So, yeah, air tube good, food tube bad.
There is some technology too I've seen, like with a camera, that you can make sure you're going into the windpipe or the trachea.
What's an NG tube? I've heard that before.
Yeah, NG is nasogastric, so that goes from your nose to your stomach. So you can put it up the nose and go down your stomach. You can also do orogastric, OG tube, but that goes down the food tube.
Got it. Okay.
And important in anesthesia too is that any contents in the stomach do not come up and go into your airway.
Yes, exactly.
Aspiration.
Well, people
pneumonia.
ask that a lot, like, well, why can't I eat before surgery? And that's really why. So when you get put to sleep, that some of the muscles that kind of keep the food down kind of relax, and so potentially food can come from your stomach and come up the food tube and get into your air tube. That's a bad
Compromise your
that
bleeding.
makes 100%.
That's like go to the ICU, get intubated like that, stay there for days to weeks.
Listener, do not lie to your surgeon anesthesiologist about when the last time you had something to eat before surgery.
Very important.
Yep.
Sometimes someone had recently eaten, but it's an emergency surgery. So can you talk to any precautions you would take if we have to do the surgery and not wait 8 hours to keep them from...
Yeah, sometimes, someone gets in a car wreck on their way home from Chick-fil-A and their stomach's full of food, and we have to get that breathing tube in very fast. We do what's called a rapid sequence induction. So instead of just taking our time, getting you off to sleep and putting in that breathing tube like in a controlled, slow way, it's more like hey, let's hurry up and get that breathing tube in. Luckily, on the end of that, it's called an endotracheal tube or an ET tube. We put that down through the in your mouth, sometimes nose, in your mouth, put it into your airway, into your trachea. There's a little kind of balloon on the end that inflates and keeps it there. That balloon can actually keep the gastric contents and the food and stuff from getting down.
Oh, it acts as like a blockage
Yeah,
thing.
it seals it off. It's not perfect, but it's the
That's cool.
Cool. All right, listener. We're learning all sorts of stuff today on what the heck is that. Our next word, Dr. Justin, for John, is...
It's an epidural.
Good pronunciation.
Oh, yeah.
Epidural, isn't it basically, I want to say a pain reliever.
Yeah.
So, because I've...
Like a pill?
It could be intravenous or it could be a pill, couldn't it? I don't know.
Okay.
And I think it's to prevent pain because I know a lot of ladies who are going into labor will ask for an epidural. So,
Okay.
because I heard giving birth hurts a little bit. So.
I don't think we'd have a very lower population if men were in charge of giving birth because we're not as tough.
No,
We are not as tough. All right. So, Dr. Justin, what the heck is that? What's an epidural?
So the most common times that people to use the term epidural is when they are talking about labor, because we will use epidural anesthesia to help with labor pain. Really, epidural means upon the dura, or
Yeah, what's the dura?
so there's coverings to your brain and spinal cord called the dura mater. There's different layers of meninges, what they call it. Basically, it encases your whole central nervous system, your brain and spinal cord. When we're doing epidural anesthesia, we can put medicine just outside that dura, usually going through your back. And we can. The most common time that we're doing it is for labor. When we're doing it for labor, it goes through your lower back, your lumbar spine, and we can put medicine in that dural space right outside the dura.
Yeah.
And the medicine kind of diffuses through and helps with your pain.
How do you put that medicine in there? Can you tell the listener?
So we go through with it, kind of numb it up first. We'll put a needle in, and then through that kind of bigger needle, we put a really small, looks like fishing line, called a catheter, really thin tube. And we put that in. We can tape that in. The needle comes out, but then the tube stays in, and we can give medicine through that to numb up, the spine from that point down. So
Like numbing medicine.
right? Yeah, it's usually local anesthetic and opioid like fentanyl, things like that.
Nice. Okay.
We can do you might have heard of epidural steroid injections. Some pain doctors will do the same space, but they'll put like a one-time injection of steroids to help with back pain and sciatica and that kind of thing.
So what is a spinal tap then?
Very similar.
Isn't it a movie?
Yeah. Can we
With
turn
a
this up to
sequel?
11?
People get confused a lot, and understandably, because they're very similar. I do lots and lots of spinals, but usually, typically a spinal it's a different layer. So instead of being upon the dura, you actually go through the dura. You go into where the cerebrospinal fluid is, and that's why it's called a spinal tap, because you can either do it therapeutically and give medicine to make you numb for surgery, or for C-sections, we do that all the time.
I heard it's more serious too because you are going through that dura.
It's you have to use a lot less, lot less medicine because you're right there where the spinal cord is.
Yeah.
It's also a little bit trickier. People will debate which one's easier or harder, but they're just kind of a different technique, but very, very similar because it's both going through the back, the low back.
Got it.
A spinal tap is usually what people say if they're just getting CSF fluid back, to see if you have meningitis or see if you have different central nervous system diseases or things. So same technique, but when I get into the spinal space like that, I'm giving medicine. Usually, I'm not usually just holding medicine. That's different doctors. Usually a neurologist or an ER doctor that does that.
Okay.
And a listener, tell your anesthesiologist if you have any back surgery. That would be important to know.
Very.
And then if after an epidural spinal, if you're getting a headache, right, Dr. Justin?
Yep, it's one of the complications that can happen.
Because that CSF, cerebrospinal fluid, can leak after, and so we need to know if you're having a headache after.
Yep.
Okay, well, good.
So-
Epidural, what the heck is that? All right, I'm excited for our next word on what the heck is that.
This is one of my favorite words.
Okay, John here is going to tell us what the heck is this word.
A laryngoscope. Laryngoscope.
Okay, how do you do on pronunciation first?
Pretty dang good, yeah.
Pretty good.
Close.
Okay, and what the heck is that?
Well, I think of laryngitis, which is if in the throat. Is that a camera that goes down your throat?
So there's different types of laryngoscope. Some people call it laryngoscope. I say laryngoscope. Doesn't
Okay.
Like GIF and GIF.
Right. Exactly.
I
Yeah.
don't
Yeah.
Is it-
There's different types of them. Typically, you have your direct laryngoscopy, which is you're looking at the vocal cords just with there's a little, usually an L-shaped tool you kind of see in movies where you put it in the mouth and kind of move the tongue out of the way and can move the tissues out of the way so you can actually see the airway, the trachea, so you can put the breathing tube in there. We also have video laryngoscopes. You kind of alluded to that earlier to intubate with. It's Gladscope or McGrath. There's different brand names that make them. But
Feel free to sponsor.
yeah, hashtag sponsors.
Hashtag spots.
So the video laryngoscope can be, like, sometimes for a more difficult airway, you can put that in there and you can see the vocal cords and things on a screen. So then everyone in the room can see it, not just the person.
That's cool.
So it's basically the tool that you use to put a breathing tube in.
Mm-hmm. And there's a blade, there's kind of curved or straight, and you have to lift up the covering called the epiglottis
Yep.
to expose the vocal cords, and then use this tool, the laryngoscope, to put that E-tube, endotracheal tube, between the vocal cords.
Yeah. If any companies want to provide these to the podcast, I would like to see what it looks like. So,
Absolutely. I should have brought stuff.
yeah, go to drbencomedy.com. So,
I like it. All right. So we know what the heck is that? Laryngoscope.
I feel like this next one is going to be like reciting a dinosaur name that I've never heard of
It's the
before.
longest word. It's the trickiest word. I'm excited.
All right. I'm excited to hear what the heck is that. All right.
Here we
Dr. Justin, listener at home, Dr. Justin has provided John with a word of what the heck is that? How do you say this word? Can I buy a vowel?
Yeah, can I? This sounds like something you'd call a mean French person. I don't know. It's, Is it suction? Is it suctional choline?
Pretty dang close.
Yeah.
Pretty dang close.
Succinal choline.
What do you think that is?
I'm thinking of choline. It's got to be some sort of, I'm going to say medicine, oleine. So
Good.
suction.
Okay. If it is a medicine, what would you use it for? Or what do you think it treats? Or
Oh boy, that's where I get confused with. I didn't take Latin, so
You're doing really well.
yeah. I'm actually I'm dead on this one. Yeah, I don't really know.
actually, it's funny you said that because
Yeah.
without him, I think you would be.
Without that,
With that and without you would be.
speaking of intubation and laryngoscope, succinal choline is a paralytic medicine that is used to paralyze people. It sounds scary, but we use that to kind of relax the body or the muscles. And in this particular, we use it to intubate. So you give it right before intubation, after sedation, because you don't want to be paralyzed while you're awake. That's a big no-no. Once you're off to sleep, we give that to relax your vocal cords and relax your body so that we can get that breathing tube in without you moving around or without your vocal cords.
Okay.
And if this were administered to you without someone managing your airway, I think you would be.
Would have a bad day.
I would have a very bad day.
You would have
All
your
right.
last day.
Be a not a good last day. Which is I don't think there is a good last day. Or, this just turned sad. All right.
All right, succinylcholine.
Succinal
All right,
choline.
listener, if you guessed any of those and have any funny responses like John, we'd love to hear what you thought each of those words meant. Please put those in the comments.